Let's face it, the struggle is real. Nursing school is super stressful at times. It can be so hard that you feel like you're chewing on shoe leather and you're waiting for a magician to come and wave their magic wand and make it all better. Well, don't allow yourself to be the victim. Find some proactive strategies to take back control of your world. Stay tuned, and I have 5 hacks that every nursing student is going to want to put into play to help ease your pain. Okay, we're going to use the ABCDE strategy to help you remember these 5 hacks. The first one is avoiding chaos at all costs, as much as possible. So how are we going to do that? I have 3 easy ways for you to do this. So first of all, we want to use our calendars and plan backwards. So if you know you have a project due in 14 days, you're going to automatically make your personal due date day 13. And then you're going to break the project apart into several steps and make a lot of multiple due dates for yourself. So you might have part A that's due on day 2, part B due on day 4, part C due on day 6, etc. And you will have the whole thing wrapped up by day 13. That'll allow you to be proactive, to make a strategy, and not be staying up late at the last minute. The second little tip I have in this area of avoiding chaos is getting ready the night before. So take your clothes out, make sure that your book bag is packed, pack your lunch part way or all the way if you can. But you want to make sure that you've done everything that you can ahead of time so that you're not scrambling in the morning. And then the third one is a really important one. You should expect about 50% of things in your life to not go exactly as planned. Now, some of them might go better than you planned, but we're going to have things that don't work out as well as we have hoped. We're going to have that time when you put on some piece of clothing and find that it's torn, or you go to pour yourself a glass of milk or juice and it spills all over the place. Just yesterday, I was making a shrimp recipe for dinner, and I picked up the bag, and all of a sudden, all this shrimp juice started to leak out, and of course, it went all over my fabric sneakers. So now I have shrimp juice all over my sneakers. They need to be washed. I can't clean them any other way but really getting them in the washing machine, right? So plan for 50% of the things to not go exactly as right. And what you do is you kind of leave yourself a buffer if you can. If you're driving somewhere, you're probably going to hit some kind of traffic. So always give yourself 10 or 15 minutes extra, and then you won't be stressed at the last minute. So those are some strategies that you can use for our letter A in our strategy, avoiding as much chaos as possible. Our second hack begins with the letter B, and it means begin to notice stressful symptoms. So what does that mean? I'm sure we've all been there. We start to get a dry throat or feel our heart pounding. Have you heard of fight, flight, or freeze responses? Well, that's what we're talking about. Do you find that you want to run out of the room, run out of the building, or just not show up? That's a flight response. Another is fight. Do you want to give the teacher an argument? Do you want to tell them why they are wrong? Do you want to tell your friends why they're not helping you as much as they should be helping you? That might be a fight response to stress. And lately, I've been experiencing the freeze response mostly. I don't know what direction to go. Do I fight? Do I flee? Is there another option for me? And I get frozen and not really sure what action to take. So whether it's fight, flight, or freeze, those are stress responses. Those are ways that your body signals to you that something needs to change. Our third hack has to do with coming up with a plan. So I'd love your help at this point. If you could drop me some comments about the kinds of things that you do to help decrease stress, I think they could help other people who are reading and listening to this video. But I'll throw out a few, for example. So first of all, other people can really help you out. You might have a friend that you could talk to, a teacher or faculty member that you could meet with in office hours. Maybe that you want to see a pastor, priest, or rabbi for some spiritual guidance. Perhaps you want to go to a counselor. Sometimes counselors will recommend things such as seeing a psychiatrist. Perhaps you need actual medication to help with your problem. There's no shame in that. So if you need medications, that can be helpful as well. You might want to join a group, a support group, or another group of people that can help you. You might engage others in prayer, or you might do personal things such as meditation, exercise, different kinds of yoga or stretching that can help release stress. Perhaps you are one that likes to read. So there's a lot of self-help material out there. And certainly YouTube, podcasts, there's all kinds of information out there. So I'd like to hear what you have to suggest. Everything works differently for people. Some of these tips might help you a lot and some might not help you at all. If you are a parent or somebody who watches elderly people, you might have to get some help. You might have to delegate some jobs. Maybe there's someone in your home or your extended family, or maybe you even need to hire somebody to help, somebody that could watch the kids while you study one night a week or something like that. But the moral of the story is you need to come up with a plan. Our fourth hack begins with the letter D, and it means to dig deeper for the root cause of your problem. So I'm not a mental health provider, and I'm not able to give you actual advice in this area, but I can give you some things to think about. And perhaps you'll want to reach out for more help later. But here are some things to think about. Are you a perfectionist and you're only satisfied with A's? Are you someone who can't sleep at night with a sink full of dirty dishes? Are you somebody that's just copying over your notes when you study and you don't really understand them? Did you make an appointment for office hours with your professor and ghost them? Well, there might be reasons why, and there might even be some self-sabotage going on. Are you ready to be a nurse? Are you ready to possibly be the breadwinner for your family? Well, there's always more to the story. It's not just about getting stressed at school, but there might be something deeper going on. So I encourage you to do the deep dive and ask yourself some important questions. Am I doing something that's not really helping? And our final hack begins with an E, and it is evaluate your progress. So how did you do? Did you come up with a plan, and did you implement the plan, and was it successful? Was it a little bit successful? Was it a lot successful? Or did you come up with a plan and not follow it? Well, all the answers are okay. They just help guide you for your next step. If you didn't actually do it, then set a date for it. Put it on your calendar. Set a SMART goal up for yourself. And then go and see if maybe you can actually improve the situation. If your strategy didn't work, you did put it into practice, but it didn't really work for you, then maybe you need a new strategy. So evaluation is always an important part of the process because it helps you know what step is next. Well, I want to thank you for tuning in today. I mean, the struggle is real, as I said in the beginning, and stress is common for every nursing student. But don't just sit there and do nothing. Put some type of plan into action and see what kind of progress you can make. And certainly reach out for help whenever you need it. You would be surprised at how many people are there for you and want you to be successful. Okay, if you liked this video, I hope you'll share it with a friend, and don't forget to drop me some comments on stress relieving measures that you have tried and have been successful. Take care. Have a wonderful day.